So immunotherapy, it's the new cutting-edge treatment option for a variety of malignancies. But if you look at the history of immunotherapy, how it evolved, how it was developed, it's not a new concept. The history, can be traced back to the late 19th century. There was a surgeon in New York, Bill Coley, who was an orthopedic surgeon, and he started to inject bacterial toxins into cancer and tumor masses in orthopedic patients. At that time it was known as Coley's toxins. And he showed that by injecting such toxins he could induce some shrinkage in the tumors. So the concept was he's going to introduce these live organisms into the tumor, and the body's natural immune system will fight those organisms. There will be a response that will be induced, and at the same time the cancer will be targeted as well. So that was the birth of immunotherapy, and then it faded away for many years. It did not spark any interest until maybe the late 50s and 60s, where there was an Australian virologist who came up with the idea of immune surveillance. What his theory was that cancer evades immune surveillance, and that's one of its ability to grow and metastasize, and eventually those virologists won the Nobel Prize in medicine. It wasn't much later, in the late 90s and early part of the last decade, Jim Allison and MD Anderson did most of the pioneering work with checkpoint inhibition, a checkpoint blockade, which is the basic concept of modern-day immunotherapy. What essentially it is there are natural synapses in the body's immune system, and these natural synapses don't allow the immune system to be active against a certain antigen or certain tumor-associated proteins. So there are natural brakes on the immune system that does not allow its full potential to be unleashed against cancer. So the initial research that came out of Jim Allison's lab in Houston, MD Anderson, led to development of multiple antibodies on modern-day immunotherapy that showed that by blocking these natural synapses in the immune system, the natural ability of the immune system can be unleashed against cancer. The first drug that came out was ipilimumab, or the other name is, the brand name is Yervoy. And that was, approved in melanoma a few years ago. That was a breakthrough, approval. And that led to multiple other novel immunotherapies. We have more than 6 drugs in the same category now, and with multiple indications. So all the way from head and neck cancer, lung cancer, kidney cancer, melanoma, so on and so forth, these drugs have been approved. We're still in the learning process because it does not work for 100% of patients. I mean, the responses across these categories is between 20 to 30% of patients. When it works, it does lead to a very durable response for a long period of time. So we need to know why it works in those patients, and we need to know why it doesn't work in the other patients.